Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
Number one thing is relationship. And when we first started Vamos, we picked two of our community partners that we already had established relationships with. And there are two African-American churches in the east side of Austin. And we already had partnerships with them through the Amen program. And we already had some of our students placed at their site for their clinical rotations. So I think that relationship over years, over time, really helped us to get in the door saying, hey, may we come and partner with you to vaccinate your congregation? So relationship building is huge when you think about trust. If you have a trusting relationship, that there's follow through. You know that the person's going to carry out what they said they're going to do. And it's not just showing up when I need something. It's showing up when my partner, my community partner, wants me to participate in whatever community outreach, and not necessarily because of something I want to do as a community outreach effort. So follow through on my end is important. I think that continues to let them know that I am committed and I'm invested. And I want to say that the School of Nursing, that Vamos and Vax Now is committed. And one of the questions that came up is, how long is this going to last? And our dean said she didn't want to start something and then we disappear when the community still would have a need for vaccines or would still want to partner with us. So we said as long as it would take is how we would. So we're in it and for the long haul. So that's part of a relationship that it evolves over time. And so I would say follow through on what you said you're going to do is a sign of a healthy relationship. I really do think it is an equity issue. I think we really need to start framing it from that lens. I have one patient with the Vax Now that we signed her up for an appointment and she was for 7 p.m. and she didn't show up. And so we're texting, trying to find her because we don't want the vaccine to expire. So we need to be able to move on to another patient, but we want to give you a chance to get to your appointment. And then she said, I'm on the bus, I got lost, and I won't be able to make it. And so we signed her up again the next time and she canceled because she's like, I don't think I'm gonna make it there on time. So we finally said, why don't we come to your home? And she's like, you would do that? And I was like, yes. And I didn't tell her that, but our team shared the playing ground isn't level for everyone. And so we have an appointment set up to go to her home next week, Monday. And normally we're finished by like 8:30, but she doesn't get off work till 9 p.m. So we're gonna go at 9 p.m. because we realize that life doesn't stop for people and it's not fair all the way around different groups, if that makes any sense at all. But I think we need to start thinking about equity.
This is kind of like meant to be an antidote for fear, which, there is a lot that like knowledge and curiosity can help with that, right? We want people to not feel overwhelmed, but more kind of give them buckets of like, is your concern this? Is your concern this? So they can start to articulate on their own and hopefully give them something interesting to engage with. We're hoping to kind of provoke their own innate curiosity to learn more if we can give them something they haven't thought of before.
People in our friends and family circles that are extremely intelligent individuals who have hesitancy for different reasons. And so we tried to instead come at it thinking about them, thinking about what is it that they're kind of tripping up on, and where can we try to tease out those little areas that are just becoming snags for people to fully understand where the safety is, where the potential issues are, and things like that.